Aside from New Leash on Life, my
This
second
is your
favorite
second favorite
franchise.
show? Okay.
Our newest segment, New York Living Well, where we get to the bottom of buzzwords in the health and wellness space.
That's right. Here to guide us through these terms and explain why you should be fluent in them is Dr. Joshua Lander. He is a clinician, researcher, and adjunct professor at Sacred Heart University. His area of expertise is neuroscience regarding rehabilitation and exercise. Welcome back, Dr. Lander.
With that 100-watt smile.
Oh my God. Good morning. Good morning. Good to see you again.
First, let's get down to brass tacks. What did you think of those puppies?
I love a puppy. I don't think there's many things better in the world than puppies.
Amen. I knew he was a smart man with all those degrees, but...
All right, our word for the day is...
inflammation.
What is it?
Definition, please.
Okay, so inflammation is obviously a really strong buzzword. Patients come in all the time thinking, I have inflammation. Do you think I have inflammation? Inflammation is basically an immune response, okay? A normal immune response to some kind of trauma, some kind of infection, or could be a stressful situation. So inflammation really is a normal immune response.
It's normal. Okay.
It's normal in the acute or short-term setting, or short-term response. However, what really how inflammation has become a buzzword is when it becomes chronic or when it becomes excessive. So an analogy is Marisol. So an analogy is so chronic inflammation can be fatigue, can be chronic pain. It is related to many conditions such as autoimmune disease, heart disease, cancers, even neurodegenerative diseases like Alzheimer's and Parkinson's. But so here's an analogy between acute inflammation, which is normal, and chronic inflammation. So Marisol will take, let's say Pete Alonso got hit in the head a couple of weeks ago.
He sure did.
And
the first baseman for your New York Mets.
When a player gets hit in the head, the normal response is the players rush the field, right? That would be an analogy would be the trauma is Pete Alonso getting hit in the head, and now the immune cells rush to the area to try to heal and try to, allay the damage.
Yes.
Correct? That is a normal immune response. Now, it would not be normal for the players to rush the field after every pitch.
Right.
That would be abnormal, right? That's the analogy of chronic inflammation. Chronic inflammation occurs when there's excessive inflammation, there's an excessive immune response, when there doesn't need to be, or if there is some kind of disease process going on.
Alex just had an aha moment.
You know what? The little light bulb went bing for me. Thank you for the sports analogy. We always appreciate
we speak sports.
You know what? He speaks sports. He speaks
he
doctor.
speaks sports.
Okay, so my next question would be then, what are some of the ways that we can prevent or at least limit the inflammation, whether it be chronic or acute, if it's possible for either of those?
Right. Sure. The argument, acute inflammation is really not a concern.
Okay.
Excessive or prolonged inflammation is. So some of the low-hanging fruit here is eat many fruits and vegetables or have a plant-based diet in general. A Mediterranean-based diet would be the classic recommendation for limiting inflammation or allaying inflammation, reducing inflammation. So the simple answer is make sure you're eating a lot of colors, right? That's the simple way to look at these things throughout the day. Make sure you're eating a lot of different colors. Be part of Jesse Jackson's Rainbow Coalition of Colors.
Not the Rainbow Coalition of Colors. Hold on. Dr. Lander.
We want to eat a variety of fruits.
Yes. Can you reverse inflammation? So say you're a woman who's 49 and you suddenly woke up and you're like, oh my gosh, I feel the presence of inflammation. Can we reverse it?
Right. Okay, so I'll answer this. The best way, the number one thing we can do is the people that are overweight or excessive weight or obese, the number one thing is to lose weight, because we know that obesity is strongly related to chronic inflammation. And so that's the number one thing besides diet, nutrition, which is of course directly related to weight. But lose weight, don't smoke, nicotine, cannabis. We don't want to be ingesting smoke into our bodies. Limit alcohol. And exercise, of course, exercise is the number one thing that we can do as far as physically for our bodies, obviously. Exercise, moderate exercise. We know that sedentary lifestyle as well as excessive exercise, such as...
Yeah, he knows. We're wrapping. I know,
we got to wrap.
Well, I don't want to wrap, but maybe I'll call you later on the way home, Lander, because I have several follow-up questions.
Inflammation.
Inflammation.
A response to some sort of trauma. There you go.
A constant rushing of the pitcher, of the
Dr.
first
Lander,
baseman.
thank you for your
Correct.
time. You can follow Dr. Lander on Instagram or at Threads at Lander Movement.
That's
Ciao.
a must follow. That's a hot follow on the gram.
Thank you,
Have
sir.
a good